Welcome to Pharmacology 2, another one of a short series of screencasts. Okay, this is particularly focusing on the different routes that medicines can be administered using, and this first slide gives you a link. This video is also available separately in the Pharmacology Learning Resource module on Blackboard. This video focuses using 3D animation on the journey of aspirin through the body, and hopefully will make some of the things that were talked about in the first screencast and in the small animations really clear by following one medication all the way through. Then stop and consider what you've learned and how you feel it will better help you understand the issues related to oral medicines and to other medicines generally as you think about the oral medications that your patients may be being prescribed. Okay, this slide indicates that although a drug is swallowed, it doesn't actually enter the internal environment of the body until it breaks down and some of its products pass through a cell membrane and get into the body. There's a little reminder of the digestive system anatomy, and again you may want to revise this a little bit so you can understand a little better what's going on and where different medicines may be absorbed in the gastrointestinal tract or gut. Bioavailability. This means that the drug has reached the circulation, so it's actually going around the body and is available to the tissues to begin its therapeutic effect. Okay, we're now moving on to topical application of drugs, and attached to this slide is an activity. So again, you may want to stop at this point, do the activity, and think and mull over coming weeks about the things that you're learning and the medicines that you're using. Clearly, topical application of drugs can happen using a different set of media, for example, ointments, patches, creams that are directly applied to the skin. Other medicines may be inhaled, and one obvious treatment relates to asthma and to asthma medications which dilate the airway passages for people who are trying to manage their asthma. Drops or ointments into the eyes, and suppositories and pessaries inserted into the rectum or vagina, respectively. So your activity is to find one example of each of these, and where possible a medicine that is being used or may be used for one of your patients or within your patient group. You can then think as you look at the medicine using your BNF, your reading, the clinical pharmacology book, and by discussing with your colleagues and your team how the medicine works and some of the advantages or the disbenefits of topical application of medicines. Okay, what about parenteral administration of drugs? This is used to describe the administration of drugs which are injected into the tissues, including directly into the blood. Oral administration means taking the drug to be so it's absorbed through the gastrointestinal tract. Other drugs can be absorbed through the oral mucosa. GTN. I've given you the abbreviation. You may need to go and find out what the full name of this medicine is, when it's clinically indicated, and how it's given. Again, little activity, add to your notes. Don't necessarily use a hard notepad, but get used to using apps and smart ways, and you may wish to record your notes, especially if you are someone who finds that a speaking medium rather than a writing medium is helpful for your learning. What about the effects on the route of administration? Here you will definitely want to go back to your clinical pharmacology book so that you can get a deeper understanding. This slide summarises the fact that different routes mean that the onset of the action of the medicine being given is different, sometimes quicker, sometimes slower, that there are different times because of absorption when the plasma concentration or a therapeutic effect is reached, maybe less, maybe more, and how long the drug will spend in the body. So another activity, find out about each of these medicines, drugs that are commonly administered by inhalation, so salbutamol, so going back to the previous slide where inhalation of medicines for asthma was mentioned, subcutaneous injection, insulin, again a very common medication, and you will likely have bumped into patients who are receiving insulin. Orally, this time I want you to consider finding a medicine that has an enteric coating, that is abbreviated to capital E, capital C. In this case, naproxen enteric coated. And snorted. Cocaine, for example. Whilst a drug of misuse, it's clearly something that many people do use and will help you understand a little bit about a substance that can cause great devastation to people. So when considering the route of administration in part of the plan of care and for the prescriber, it needs to be thought about what is the most convenient route for the patient. Where is the drug going to act? And how quickly does the therapeutic effect need to be reached? Is it something that needs to be given more quickly and if possible via an intravenous route, or is it something that is more slow and an enteric coated medium is used? How long does the prescriber want the dose of the drug to work? And which organs is the drug to be kept away from? Stop again, pull out your clinical pharmacology or any other books that you're finding useful, and sit down and think, again with regard to your experience in practice, about the convenience of routes and the different routes that your patients receive their medication. Here we've got advantages and disadvantages of oral administration. A straightforward list for you. You may think of more. Venous injections. Again, a simple list, which I'll leave you to read through. And again, there may be others, but it is really worthwhile thinking about it, because when you know the patient well, and perhaps are talking to a prescriber, be it a nurse prescriber, an AHP prescriber, or a medical prescriber, you may be able to advocate for the patient where there are some clear advantages or disbenefits for them. Subcutaneous injections, probably one of the most common medicines given via this route is insulin. The little picture shows you the most common and mainly used sites. Insulin and heparin are two examples. Hopefully you looked up about insulin earlier. Heparin, maybe you need to go away and just discover what that is. Again, you're asked to think this time for yourself what you feel the advantages and disadvantages are to this route of administration. Perhaps your patients have told you something about how it is for them. Okay, again I'll leave you to read this. Do stop and start as many times as you want,